A closer look at colorectal cancer. What is it? Colorectal cancer, also known as bowel cancer, colon cancer, or rectal cancer, is cancer that develops in the colon large intestine, or rectum. It occurs when cells in the colon or rectum grow uncontrollably and can invade or spread to other parts of the body. The disease typically starts as a benign tumor, often in the form of a polyp, which over time becomes cancerous. The colon is the first and longest part of the large intestine, while the rectum is the last several inches of the large intestine. Together, they form part of your digestive system and play a crucial role in processing waste from your body. The global impact. Sobering statistics. Colorectal cancer is one of the most common cancers worldwide. The numbers tell a powerful story about why awareness and prevention are so critical. Currents. Global burden. The most frequently diagnosed cancer and second most common cause of cancer-related deaths worldwide. In 2020, more than 1.9 million new cases and over 930,000 deaths occurred globally. Fourth most common cancer in the U.S. among men and women combined. 2025 projections for the United States. The American Cancer Society estimates that in 2025, 154,270 people will be diagnosed with colorectal cancer. 52,900 people will die from the disease. 1 in 24 people will be diagnosed with colorectal cancer in their lifetime. Rising concern in young adults. Perhaps most alarming is the trend among younger populations. About 10% of colon cancer cases are diagnosed in people under 50. These numbers are rising 1 to 2% each year. Recognizing the warning signs. Early detection saves lives, but colorectal cancer often doesn't cause symptoms in its initial stages. When symptoms do appear, they may include primary symptoms, changes in bowel habits lasting more than a few days, diarrhea, constipation, or narrowing of stool, blood in the stool, bright red blood or dark, tarry stools, persistent abdominal pain or cramping, unexplained weight loss, weakness, and fatigue. Feeling that you need to have a bowel movement that's not relieved by having one advanced stage symptoms when cancer has spread. Additional symptoms may include jaundice, yellowing of skin or eyes. If liver is affected, breathing difficulties. If lungs are affected, severe abdominal pain and bowel obstruction, headaches or seizures. If brain is affected, understanding risk factors. Lifestyle-related factors. The majority of colorectal cancers are due to lifestyle factors and genetic disorders. Key risk factors include diet, high consumption of red meat, processed meat, and alcohol, physical inactivity and sedentary lifestyle, obesity, and being overweight, smoking tobacco. Medical risk factors. Age. Risk increases significantly after 50, with average diagnosis age being 66. Inflammatory bowel disease, including Crohn's disease and ulcerative colitis family, history of colorectal cancer, inherited genetic disorders, though these represent less than 5% of cases. Treatment options. Modern approaches to fighting cancer. Treatment for colorectal cancer has evolved significantly, offering hope to patients at all stages. Surgical treatment. Surgery remains the primary treatment for resectable colorectal cancer. Colectomy, removal of part of the colon, is the standard treatment for colon cancer. Complete lymph node removal to prevent spread. Minimally invasive techniques are increasingly available. Chemotherapy regimens. Current chemotherapy combinations include FOLFOX, leucovorin 5-FU, and oxaliplatin FOLFIRI, 5-FU, and irinotecan capaxcapestabine and oxaliplatin, various combinations with targeted therapy drugs, targeted and immunotherapy bevacizumab monoclonal antibody. As first-line treatment, immunotherapy drugs like pembrolizumab and nivolumab for specific genetic profiles, personalized treatment based on genetic testing of tumors. Radiation therapy used primarily for rectal cancer treatment can help shrink tumors before surgery. Palliative care to relieve symptoms in advanced stages. Prevention. Your power to reduce risk. The encouraging news is that colorectal cancer is largely preventable through lifestyle changes and screening, primary prevention strategies, dietary changes, eat a high-fiber diet rich in fruits, vegetables, and whole grains, limit red and processed meats, steaks, burgers, bacon, sausages. Reduce alcohol consumption to no more than 1 drink daily for women to for men. Connect with support groups and cancer communities. Work closely with your healthcare team for personalized treatment, focused on nutrition and gentle exercise during treatment. Seek mental health support when needed. For prevention-focused individuals, schedule regular screenings according to guidelines. Adopt healthy lifestyle changes gradually and sustainably. Stay informed about new research and recommendations. Share knowledge with family and friends. Here is what you need to know. When to start screening. Age 4575 is now the recommended screening age range, previously age 50, but lowered due to increasing cases in younger adults earlier. Screening may be recommended for high-risk individuals. Screening methods: colonoscopy, direct visualization allowing polyp removal, stool-based tests, non-invasive methods like fecal occult blood tests, FOBT, sigmoidoscopy examination of the lower colon, CT colonography, virtual colonoscopy using imaging. Why screening works: identifies precancerous polyps before they become malignant, detects early-stage cancer when treatment is most effective. Studies show screening reduces both incidence and mortality, prognosis and survival rates. The outlook for colorectal cancer patients has significantly improved over the decades. Encouraging trends: death rates have been decreasing since the mid-1980s due to improved screening and treatment. More than 1.5 million colorectal cancer survivors currently live in the U.S. Early-stage cancers have much higher survival rates than advanced-stage cancers. Importance of early detection. Timely diagnosis and appropriate treatment are crucial for improving survival rates. Regular follow-up care significantly impacts quality of life. 5-year survival rates are excellent when cancer is caught early. Breaking the silence. Overcoming barriers to care. One of the biggest challenges in fighting colorectal cancer is overcoming embarrassment and stigma. Connect with support groups and cancer communities. Work closely with your healthcare team for personalized treatment, focused on nutrition and gentle exercise during treatment. Seek mental health support when needed. For prevention-focused individuals, schedule regular screenings according to guidelines. Adopt healthy lifestyle changes gradually and sustainably. Stay informed about new research and recommendations. Share knowledge with family and friends. Connect with support groups and cancer communities. Work closely with your healthcare team for personalized treatment, focused on nutrition and gentle exercise during treatment. Seek mental health support when needed. For prevention-focused individuals, schedule regular screenings according to guidelines. Adopt healthy lifestyle changes gradually and sustainably. Stay informed about new research and recommendations. Share knowledge with family and friends. A message of hope and action. Living with or facing the risk of colorectal cancer can feel overwhelming, But remember that knowledge is power, and action creates hope. Every day, researchers are developing better treatments, survival rates are improving, and more lives are being saved through early detection. You are not alone in this journey, whether you're working on prevention, supporting a loved one, or fighting cancer yourself. There's an entire community of survivors, families, healthcare professionals, and researchers standing with you. The statistics may seem daunting, but behind every number is a story of courage, resilience, and hope. Take that first step. Whether it's scheduling a screening, making a dietary change, or having an honest conversation with your doctor, your health is worth fighting for, and every action you take today is an investment in your tomorrow. Together, we can turn the tide against colorectal cancer. Your story matters, your health matters, and your future is worth protecting. If this information has helped you understand colorectal cancer better, please like this content, share it with others who might benefit, and subscribe for more health awareness content. Knowledge shared is hope multiplied. Let's spread awareness and save lives together.